I'm Dr. Segura, a neurologist who specializes in peripheral nerve disease. My interest in this has evolved over the years due to the fact that there is a tremendous amount of people with neuropathy who have not been properly diagnosed. They're suffering disabling pain and other symptoms, and we decided to tackle the problem from a different angle. I'm a trained neurophysiologist that specializes in diagnosing peripheral nerve disease. We have vast experience with the population of diabetes who are, again, very poorly diagnosed and treated because of lack of information. We're here to try to bring something to the public which is meaningful, since we believe that diabetic pain and other neuropathic pain can be treated and people can lead normal life. I have with me Dr. Rodriguez, who is a specialist in foot surgery and has developed keen interest in peripheral nerve problems from the standpoint of clinical disease as well as surgical disease. Dr. Rodriguez, can you tell us a little bit about your background?
Well, exactly. I think that the main thing that we see with our patients is that they don't get the proper diagnosis of neuropathy. Either they're diabetic, or chemotherapy, or alcoholic neuropathy, or vitamin deficiency. They don't have the right diagnosis, so they're not properly getting the right treatment. What we have been able to offer is offer them is the right diagnosis with the right testing, nerve conduction study that is very, very specific to let us know what is the specific site that the nerve is affected. MRI, we use them quite a bit also, physical therapy, and also we are performing diagnostic ultrasound nerve blocks to either let us know how affected is the nerve, and also how to treat more effectively. From a surgical standpoint, once the patient that meets surgical criteria, which is usually about 10 to 20% of the patients that require any kind of surgical decompression or release of the nerve that may be pinched, and that's something that could only be determined with the right diagnosis.
Yeah, I agree with that. I think the main take-home point is really to have a correct diagnosis, which in the majority of cases has failed to occur. And once that we know what we're treating, I think we can probably derive some solutions, not just from the medication point of view, but also other alternative approaches. And ultimately, many of these people do have a what we call a pinched nerve or entrapment neuropathy, which can be released, and people can be helped with some very specialized surgical approaches that deserve some attention as well.